Well, according to a 2021 study released by Brown University, since 9/11, there have been 7,000 combat and training related deaths in the U.S. military, while 4 times that number of servicemen and women have committed suicide. And the rate among women is increasing dramatically. Why is that, and what can be done about it? That's the topic of this week's in-depth conversation with moderator Susan Cadeau and her guests.
Thank you, Rich. This is an important topic to cover for all of Oklahoma. It doesn't affect just veterans, but loved ones of veterans, family, friends, and we have a team who can really help us see into what happens in this arena. I'd like to introduce them to you now. First, we have Leslie Franklin, who is the Community Engagement and Partnership Coordinator for the Suicide Prevention Team at the Oklahoma City VA. We have Waco Blakely, who is a veteran and serves full-time at the Tulsa VA Medical Center. And then we have Daphne Hillhouse, who is a suicide prevention coordinator at the Jack C. Montgomery VA Medical Center. Thank you all for being with us.
Thank you. Thank you.
Well, Leslie, I'm going to start with you. Tell us a little bit about what you do in your position.
Right, thanks. So for the suicide prevention team at the Oklahoma City VA Medical Center, I really focus on community education, outreach efforts, and coalition building, focused solely on the issue of preventing veteran suicide. So it's less clinical and more community-based, which is a new initiative that the VA has pushed out.
Daphne, I want to come to you next. What are you seeing in your position, especially when it comes to being a part of the suicide prevention team?
Our suicide prevention team is a small team of people who addresses suicide prevention concerns through training and outreach, like Leslie said, but also working directly with our veterans who have had recent suicide attempts or prepared to die by suicide. And we have seen an increase in suicides recently, especially since COVID.
Okay. And Waco, I want to come to you. You were telling us before we started a little bit about what you do in your background. Can you kind of share that with the audience?
Yeah, certainly. I'm a veteran of 20 plus years, United States Marine Corps, as well as the Oklahoma Air National Guard with combat deployments into Iraq and Afghanistan. I've served a lifetime of military, and I've been fortunate enough to work for the Department of Veterans Affairs for the past 17 years. First serving as a patient advocate for our severely injured Iraq and Afghanistan veterans there in Oklahoma City. I've since moved to the Tulsa area, where the first 5 years here, I worked with our VA homeless program. And over the past year, I've been working out of the medical center in Muskogee as our health systems redesign coordinator. And that's just a long title for hoping to create some process improvements throughout our entire Eastern Oklahoma VA healthcare system.
So Waco, as we look at statistics that show an increase in suicide attempts by veterans and suicides, both in men and women and minorities, you know firsthand what it's like coming back from a tour of duty and dealing with combat in the field. And then you've also been literally bedside with folks. What is the biggest reason that you think exists for this increase?
You know, I would like to tell you that there is one singular identifier, but that would not be accurate. There is a multitude, in particular for my generation of veterans, those that have served after 9/11 of 2001. It was such a long, drawn-out period of combat, multiple deployments. Some of those men and women were severely injured, to include traumatic brain injury, a multitude of certain psychological and psychiatric issues, and then coming back home to a place that became a little bit foreign to them, whether it was inside their employment, whether it was inside their own families, friends. And those difficulties, while physical, can be quite visible. The things that's going on from a mental health perspective, very invisible.
Daphne, what do you see?
I agree with Waco. I think a lot of our veterans are having difficulty transitioning between those two cultures, between our military culture and our back into civilian culture, having a disconnect from their social support, whether it's due to multiple deployments. The military is not necessarily a very family-friendly place for our service members. So coming back from those chronic pain, severe injury, but really losing the mission. Where is my connection? Where is my purpose now? How do I translate what I've done in the military into my civilian life, and how do I connect to the people who support me, my primary relationships, my spouse, my kids, my parents, and not necessarily directly due to combat service, but just losing some of that social connectedness, not belonging, not feeling like I belong or have a mission.
So Leslie, I want to come to you. When you do that community outreach, how do you find veterans or folks who need help if they're masking it, so to speak, and keeping it private and hidden?
Thanks. So I think one of the things is for this being a new position and a new program and getting out in the community and bridging that gap between the VA hospital and our communities in the state of Oklahoma is just getting out there and finding veterans where they are, meeting them where they are, having honest conversations with them in like environments that feel comfortable and safe. A lot of veterans do feel like that it's hard sometimes to come to the VA hospital. It's hard sometimes to engage in that. They don't know where to begin. They're struggling with that transition, and going out into their communities where they feel safer and maybe more connected and starting that conversation can open up to some really genuine, heartfelt interactions and dialogues, and can really engage them in a different way.
So this next question is really for all three of you. Any of you can answer it or talk amongst yourselves. I want to talk about the USS George Washington, where 3 U.S. sailors committed suicide within a week of each other. So they are on duty. Is there something the military is missing when it comes to morale among its members? Waco, do you want to take that one first?
Well, I tell you, as much as there is a challenge, whether it's the United States Marine Corps, the United States Navy, Army, Air Force, it's really irrelevant. There is still a stigma to this day on seeking mental health care while you are active duty, reserve, or simply serving the National Guard. There is a perceived threat that I will not be eligible for promotion. There is a perceived threat that I will be dismissed, I will be discharged, I will be in poor standing. I will lose everything that I know to be my total fiber. That still exists to this very day. I'm not saying that the Department of Defense has not addressed this very issue. They have. The annual training requirements, the annual hot wash, if you will, that these men and women listen to throughout the entire year are very real.
I'm going to stop you, Waco, real quick. What's a hot wash?
And hot wash is typically after somebody has committed a suicide. There's an all call for all personnel, regardless of rank, regardless of position, and you listen and you review and you discuss, and it's a very open format on discussing that particular suicide that may have just occurred. I went through that process myself with one of my own troops back after our very first deployment in November of 2002. Once we returned, it's almost, I'll be honest, it's a little bit demoralizing when you're talking about a suicide immediately after a suicide. That is a challenge in its own right. When you're talking with additional troops that are now trying to understand and grieve that very intimate loss that's right there next to them.
Daphne, is there the attitude of, kind of suck it up, be tough? You think of all those movies, you just got to be tough. Is that pervasive? Is that what you're hearing from folks that you speak with?
Yes, and I think that goes back again to that cultural shift. And they come back to a society that, quite frankly, views them as heroes. That's a big thing to live up to. If I ask for help, do I have this hero status anymore? And it's not just our service members. We have first responders struggling with the same thought. If I get help, are they going to take my weapon? Are they going to take my badge? Are they going to take my job? And then even among mental health professionals, there is a stigma. If I were to go get mental health help as well, is this going to affect my license? So I think this is really talking about a national cultural change, not just among our service members or military.
So Leslie, if we've seen this increase since 9/11, but we're supposed to be becoming more aware of mental health needs. Why isn't that going down? Why is it going up? And I might add that the statistics show that it's going up among women and minorities as well, correct?
I think overall, like the trends are still going up, but if you look at like year to year, the National Veteran Suicide Prevention Annual Report that comes out every year, and for 2021 reports back on 2019, it's always kind of 2 years behind, because that's how long it takes to go sift through the data. But there was a 7% decrease in the adjusted suicide rate for veterans from the years of 2018 to 2019. And that's the largest decrease for any single year since 2001. And since that data is 2 years behind, we are starting to see it come down. It's still high, but those rates are coming down. And I think as the years come out, it'll show us that a lot of these efforts that we're putting into recently, like community-based interventions, our postvention efforts, raising awareness, reducing mental health stigma, that those efforts are working and we are heading back down in the right direction.
Waco, so we've looked at the trends, we've looked at the stats and the numbers and the situation. Let's talk about what's the first step in helping. When you have a veteran that comes to you who has maybe attempted suicide, what's the first thing you want to say to them?
If there's been an attempt, it is them asking for help. Is exactly what that is. There's a certain need of empathy, as well as being sympathetic to those conditions that veteran is currently in. But there's the seriousness, obviously. That veteran is asking for that help. That veteran is in a certain way, shape, or form demanding that type of help. And again, the reasoning may be widely different. We had mentioned that the increase in women. There's more women that serve in the United States military in different roles more than ever in our history. And so the experiences that they've had in combat, up close and personal, the things that they've seen, the things that they've done is widely different than generations of past. And so the seriousness of taking that veteran that has had an attempt is very dear and near to each of us, and something that we take very seriously and start to move on rather quickly. And I know Daphne and I have some recent experience on a suicide that was very near and dear to us. But we cannot stop making the attempt to help each and every one of these men and women. It just cannot happen. We will continue to press. We will continue to push. And see what we can do for each and every one of these men and women.
Daphne, if someone approaches you looking for help or has made out a cry for help, what do you say to them? Maybe someone's watching right now.
The VA has made incredible efforts in making available to all veterans and their family members and service members very easy, quick crisis response through the Veterans Crisis Line. But when veterans come to us specifically, or their family members, we want to make sure that wherever the veteran is, that they're in a safe place and getting that support to them. It always comes back. Even your question about the USS Washington, we're always coming back to those social supports, connectedness. Where can I find that connection? I'm going to work on connecting with the veteran first, building rapport, tell me about what's going on, really normalizing the feelings, because if we're honest with ourselves, all of us have thought it'd be better to not wake up tomorrow.
Leslie, it sounds like trauma that almost seems too overwhelming to address. Is this a step-by-step way to fix it? And is it hard to convince people it's worth taking that first step?
Absolutely. And I think what Daphne was saying was definitely normalizing the experience. And my work as a clinician, working with high risk for suicide veterans, normalizing it. And one of the greatest protective factors against suicide is having a sense of belonging, a sense of purpose, and walking with that veteran to find out what that may be. They may have lost sight of it. And they can't see it, but you can, and seeing like what that sense of purpose, what their connection or their belonging is to their family, to their communities, whatever that may be.
Wonderful. All right. I want to thank all of you for giving us your time, your attention, and your insight today. I know there are people out there watching who needed to hear the information that you had to share. We'll be putting up some information on our website, oeta.tv, where people can go to get help for this very important issue, one that is overcomable. Thanks to all of you.
Thank you.
Thank you, Susan.